Well, welcome to the Get Fit with Jodelle podcast. I am, as usual, Jodelle. And if you've tried everything as a biohacker or a mitochondriac and you're still dealing with health issues, perhaps this next episode will elevate your thinking to try a couple more solutions for issues that are long-standing issues, specifically when we're talking about an oxygen deficiency. We definitely want to keep oxygen within the cells of our body. Many of us nowadays are oxygen deficient for a variety of reasons. And since we rely on oxygen vastly at a cellular level, it's imperative that we focus on the most effective ways to enhance our oxygen levels. So today's guest will definitely breathe life into how we can do this. Dr. Scott Sherr is joining me to talk methylene blue, which we've talked about on other podcasts before, but I don't think we've talked about it like this. So you definitely want to listen in. And something called hyperbaric oxygen therapy, which we've never talked about on this podcast either. So I'm excited to find out about that. And stay tuned, because you guys, even if you don't have this sort of therapy, which you'll learn about in the vicinity that you live in, like myself, I don't live in an area where this sort of therapy is available. We're going to talk about ways to even maybe slightly replicate oxygen, hyperbaric oxygen therapy. So Dr. Sherr is the director of integrative hyperbaric medicine and health optimization at Hyperbaric Medical Solutions. And he's an independent provider of integrative hyperbaric oxygen therapy. And he runs a worldwide education, consulting, and advocacy telemedicine practice, and is also one of the few medical doctors in the country using an integrative approach. So the hyperbaric oxygen alongside targeted lab work, diet, and supplementation to further hyperbaric oxygen therapy's ability to heal. So Dr. Sherr, welcome. Thanks for coming on.
Thanks, Jodelle. It's really a pleasure to be with you today.
Yeah.
Wherever you are today.
Well, I'm looking forward to talking with you all things about how to boost our oxygen levels, because I really do think a lot of us are more oxygen deficient than we give ourselves credit for. Yeah.
It's an interesting concept, because most people that would go to their doctor's office and get a pulse oximeter reading. So this is a reading on your finger of how much oxygen is saturated in your bloodstream, would measure somewhere between about 96 and 100% oxygen at that time. And that's measuring is how much oxygen is being carried on your red blood cells. Red blood cells are the cells in our body that carry oxygen. But where they're going and how efficiently they're using the oxygen that's being carried and then being dumped off into the tissue are very different things. And so when it comes to chronic illness, chronic inflammation, chronic oxidative stress, your body doesn't have as good of an ability to utilize that oxygen that may be on those red blood cells to make energy effectively. So even if you have a pulse ox reading of 96 to 100%, which most people will at any altitude, because if you live at altitude, you'll eventually be able to optimize your oxygen levels on your red blood cells even at higher altitudes. But the difference is how well you're utilizing that oxygen on the cellular level. And that's where the variation is dramatic depending on your overall health.
Wow. Yeah. So it might show up, just like with blood work and other tests, it's not always accurate to see how you're really oxygenating, but yet symptoms don't lie. So what about somebody who's fatigued all the time?
Exactly. So, and that's where we go is symptomatically, you can see areas where oxygen is not being used effectively. And it's not just usually an oxygen deficiency. It's oftentimes related to your physiology, your biochemistry. How well are you making energy in your cells? How well are you detoxing from energy production? How much inflammation is ongoing? Do you have cytokines or like these chemical messenger factors in our body that are out of control, and you have all this inflammation that is just mucking up the whole system? Do you have poor anatomy where you can't detox well from a cerebral spinal fluid perspective if you have challenges with your neck or your spine or your brain, or even, there's lots of different ways that you can potentially see this. So symptomatically, oftentimes, if you have low oxygen levels or a low ability to make energy effectively, you'll get fatigue is usually the number one thing that I see. Detox problems, gut issues are usually common as well. The reason for that is that where we have the most mitochondria in our body is in our skeletal muscle, which is where we need it the most for very fast acting if we need to run from an animal or just run and pick up your child before they do something crazy or whatever it might be. And you need to be able to use those mitochondria in your muscles, but also your brain, your heart, and your liver. So if you're not able to make energy effectively, that's where you're going to see the most impact on your symptom and symptomatically. So if you're not making energy effectively in your brain, you're going to feel fatigue, you're going to have brain fog, you're not going to be able to think well. If you're not making enough energy well in your liver, you're not going to detox well. You're going to have gut problems. You're going to have issues with taking medications and supplements and dietary challenges, right? Because the liver processes all of your food, all the nutrients, everything that comes from your gut goes through your liver and gets detoxified or processed in various ways. So those are the major symptoms that you'll feel if you're not making energy effectively from the oxygen that you're carrying.
Yeah, wonderful to know, because I think people are just expecting that, okay, if I'm tired, then it just must be I'm not eating enough or I'm eating the wrong foods. But really, it could just be the mitochondria are suffering. And that's generally what most of the issues of today are, is a mitochondrial issue. Yeah. So,
yeah, I would agree with you. I mean, I think what it comes down to is that your mitochondria are they do so many things. They're often called the powerhouse of our cells, the places where we make energy, but they also communicate with your nucleus. They communicate with other cells. They communicate with bacteria. Like there's all these other ways. And you've had people that are much more skilled at talking about mitochondria on your podcast than me. But from my perspective, what I care about is, in the world that I work in as a clinician, is how can we make the mitochondria work more effectively? And so I've worked in the field of hyperbaric medicine, hyperbaric oxygen therapy, where we're driving more oxygen in circulation. And that's certainly a fantastic way to make a stimulus where you have more oxygen, more energy produced. But in the same breath, it's always important to understand that more oxygen is not potentially always the answer right away for people, because the mitochondria need additional support to be able to make energy more effectively. So there's so many ways you can go about in thinking about your mitochondria, everything from, optimizing your health to trying to treat cancer and looking at that particular aspect of the Warburg effect and those aspects of mitochondrial function too.
Yeah, well, you kind of read my mind, because the first place I wanted to go was to talk about just some bare bones basics of how to optimize mitochondria. Like, I want to get to these two really great tools that you can use to oxygenate your body, but also, what do you as a doctor recommend that anyone can and should be doing outside of what most doctors are going to say, which is eat less and move more and take these pharmaceuticals versus you're not going to see much improvement with your mitochondria in those ways, but what do you recommend just from starting?
That's a good question. I mean, usually you want to do the basics always. And that is something that a lot of people in the biohacking community, the optimal performance community, they sometimes forget. They like the shiny little tools, right, the technologies, the supplements and things like that. I mean, I have some very basic, but I think foundational supplements that I like people to try to consider when we're looking to optimize mitochondrial function. But the major thing that I'm doing really oftentimes, Jodelle, is like, how can we decrease inflammation? Because if we can decrease inflammation, then the mitochondria are going to function better. So if you have a lifestyle where you are focused on decreasing inflammation, so decreasing inflammatory foods, decreasing inflammatory light, decreasing inflammatory relationships, decreasing inflammatory ways that you're hydrating yourself, and you're not having tap water, for example, with all the stuff that's in there and down the line. So for me, it's always the easy things first. It's, what are you eating? What are you not eating? When are you taking time to stop eating, like fasting, for example, or intermittent fasting? What are the relationships in your life look like? And how is that actually manifesting in various ways that are causing inflammation? Because that all does too. And then relationships is part of that, of course. And then I think also of sleep, of course, and how much are you sleeping? Because sleep is really important from a detoxification, inflammatory perspective. And I think about, I'm forgetting, but hydration, I mentioned hydration already. Those are the basics, sleep, diet, hydration, then movement, of course. And then there's movement practices. And then there's also the idea of not eating, and the idea of taking time and intermittently fasting and taking time off of food. So and then plus relationships and that kind of thing. So those are my major things that I think anybody can work on without having to spend any money, really, which is just educating yourself on how you can decrease inflammation systemically. Then the second layer of that, for me, is usually, if people can't afford testing, for example, and they don't have the ability to get comprehensive lab work, is then bringing in some mitochondrial support in various types of supplement ways to increase the ability for your mitochondria to work better. And my favorite supplement in that category is methylene blue, which I know you've spoken about in the podcast before.
Yeah, I can't wait to dive into that. But I have to bring up the hydration piece
Yeah.
because we have a similar love for a book that I heard you mention on another podcast called Your Body's Many Cries for Water.
Oh, yes, of course.
It's not a well-known book, but when you mentioned it, I got excited because it's so true that we underestimate our need for water. And there's even a movement of people who really feel that as long as you're drinking milk and orange juice and coffee, you're getting enough hydration. So I do want to remind these folks that prior to the invention of orange juice and coffee, humans really only had water and maybe the occasional milk source from an animal available. So It kind of stands to reason that while some things can hydrate us, our bodies still require pure water to flourish. Yeah.
Absolutely. And yeah, I read that book. My father, who's a chiropractor, who I learned a lot of my craziness from, he gave me that book probably in the mid 1990s when I was an athlete in high school and trying to maintain my performance. And what I think is also important on the hydration side is we're not just talking about water. We're talking about water in its purest form, which would be mineral water, ideally. Reverse osmosis water, which is better than tap water, no doubt, is still devoid of any minerals in there as well, and especially salt. When you want to absorb your hydration, you need to have minerals with your water at the same time. Salt especially, because salt is a carrier, it's a transporter. So when there's salt in your water, it will get transported across your gut lining and then get diffused into your body. If you just drink reverse osmosis water, then it doesn't have the same effect and you don't get as much of the benefit of drinking water. And there's, of course, lots of different ways of skinning this in the sense, and there's lots of different ways you can optimize it. You can ozonate your water. You can put it under lights and you can UV it. You can do lots of different types of things. But in essence, for me, the most important is usually mineral infused water.
Yeah, you mentioned ozonate your water. I have an ozone water maker. Do you think that brings minerals in, or is it just kind of bringing the ozone benefit?
I think it's probably more the ozone. Yeah, the ozone benefit, but still need to add in minerals. So in my house, I have a reverse osmosis system for the whole house, but we have a mineralization system underneath the sink. So all the water that we drink, all the water that we use for cooking is mineralized in that way.
That's excellent. Good to know. Okay, so now we can move on to our topic at hand, which is methylene blue, because I love to talk about it. And, for those who haven't heard anything about it, what is it? And kind of tell the history behind it, if you don't mind.
Yeah, no, of course. It's a fantastic compound. It was initially invented in the late 1800s as a textile for dye. In fact, early blue jeans were dyed with methylene blue. And it was soon realized, I don't know how this actually happened, that it treated malaria. And so it was from like the late 1880s until about the 1930s or 40s, where methylene blue at higher doses was an antiviral, antibacterial, antifungal, and antiprotozoal, which is for the malaria bugs. And it worked fantastically well. Side effect, though, is that it made your urine blue, and it also made other secretions blue at higher doses. So when antibiotics were invented in the 1940s and 50s, methylene blue fell out of favor. And at the same time, it was also starting to be used for other indications. The major one actually was in laboratory analysis, because they knew that methylene blue stained a particular organelle in your cells, which happens to be your mitochondria, of course. Methylene blue was used as a derivative. So derivatives of methylene blue actually became certain antipsychotic drugs as well in the 1950s. And they were actually adding methylene blue to certain antipsychotics as well, because they wanted to make sure that these people were actually taking their medications. And if you peed blue, you knew that people were taking their antipsychotic medications. So it's got some interesting history. And then on the mitochondrial side of things, it wasn't really until like the late part of the 20th century and really into the 21st century now, where we know that methylene blue works at least 5 ways or more in your mitochondria to help optimize energy production. It does it, and one of the major ways it does that is it actually acts like oxygen in your cells, and So when the electron transport chain is working, what happens is that you have an electron going through it and it needs an electron sink. That usually is oxygen, but methylene blue can actually act just like oxygen and can actually take that electron, and then you can continue to make energy as a result of that. So that can happen if you have oxygen around, or if you don't have oxygen around as much. Methylene blue can support the ability to make more oxygen. It also revs up the ability of cytochrome oxidase, which is complex 4 of your mitochondria, to make more energy faster and more efficiently as well. So it's doing that, and also changing the conformity or the affinity of oxygen for the red blood cell in the tissue, so that more oxygen is being dumped into the tissue. So you're getting more energy produced that way as well. And also increasing your amount of NAD plus in your mitochondria, which is also needed so that you can help make more energy at the same time. So those are the ways that it's working in the cell. And then it's also working as an antioxidant because it works as an electron cycler. So it will basically mop up free electrons that can happen after energy is being produced. And so you have an antioxidant at the same time as something that's helping you make more energy, all happening in your mitochondria all at the same time.
Oh, wow. So did I hear you say right? It can act as both an antioxidant and an oxidant?
So it can act like an oxidant at higher doses.
Okay.
So for the most part, low dose methylene blue, which is less than about 2 to 3 milligrams per kilogram. So still pretty high dose,
yeah.
But less than that, it acts as an antioxidant. So it's basically able to take electrons, reduce itself, as opposed to at higher doses, it becomes an oxidant. So it becomes more of an oxidative stress to the system. Higher doses of methylene blue have actually been used in people with sepsis and other, significant inflammatory disorders, even viral things as well, that you may have heard of the last several years, as a way to help actually support the ability to kill bugs, is what it comes down to, or really make sure or cause a stress on the body so that the body responds in a way that could potentially protect itself. Like when you're septic, for example, your blood vessels dilate massively, and this happens everywhere, but high doses of methylene blue will help you vasoconstrict back down. But for the most part, we don't use high doses of methylene blue. We use lower doses for the antioxidant properties, for the energy producing and supportive properties. And it also has some ability to increase neurotransmitters as well that may also help with you feeling better, like acetylcholine and dopamine and serotonin. These are all neurotransmitters that are released when methylene blue is around as well.
Yeah, I still remember the first time I took it, it was like my body it was like a light bulb turned on in my body. It was like, not only did you feel really good, but your brain felt like I could do anything, like I could write anything. And I don't know, it was just an immediate feeling. So I don't know if other people have felt that before, but immediately, that's why I've stuck with it for as long as I have.
Some people do.
Like that?
Some people do have that immediate experience, and other people actually have challenges with it. And that's actually a pretty diagnostic category as to where you are, in the sense if you take some methylene blue, it's supportive, you feel the extra energy, as you just described, Jodelle, that usually means people are pretty well optimized. And also, it also means that it could be in people that or just need a little bit of extra oxygen to really be optimized, right? As opposed to people that don't feel that way. If they don't have the same kind of energetic bump, that usually means there's more cellular work to do so that you will feel that. And that could be from vitamins, minerals, nutrients, could be from a detoxification perspective. Sometimes methylene blue actually causes a detoxification reaction in people. And although that's not why they took the product, that's usually quite diagnostic in the sense that, okay, there's something else going on here that I need to address. So what I often, though, the way it's dosed and with my company is very low dose initially. And we have these particular types of products so that you can easily titrate, so that you can start off at a lower dose and then you can slowly build up to a higher dose where you'll be able to tolerate it better, as opposed to starting with a very high dose initially.
Well, let's talk about dosage, because when you were saying, what'd you say, 2 to 3 milligrams per kilogram, which still be quite a bit. I mean, I think even I'm not taking that much. Like
most people aren't. No.
Yeah, it's almost like maybe if people haven't noticed the effect of it, they may actually be underdosing.
It's possible if there's no if there's no effect at all, it's possible that you could be underdosing. But for the most part, what's been studied in the cognitive impairment side of things is about 16 milligrams of methylene blue, which is much lower than 1 milligram per kilogram. And so usually in my experience personally, and also with the people that I work with as a physician and in the users of our products, the sweet spot for people is usually somewhere between 5 milligrams and 16 milligrams. So 4 to 16. So which works well for our products because we have these things called troches, which dissolve in your mouth between your cheek and your gums, and they're titratable. They come in a square form, and you can score them. They're scored, so you can break them up into quarters. So each quarter is about 4 milligrams of a dose if you have a 16 milligram troche, for example.
Yeah, I definitely want to get into those. But going back to the methylene blue, so what are the benefits? Like I talked about, I felt it in my brain, I felt it in my body. I was going through biotoxin illness, like mold exposure at that point. That was part of my treatment that I wanted to do to kind of get my body back online. And I definitely, that's why I stuck with it. I definitely noticed the effect of it helping with that sort of thing. But what are some other things people might notice other than blue pee?
Yes. So the methylene blue does concentrate in your urine. Yeah. So you will notice urine that turns blue or green or light blue, depending on your hydration status.
Yeah.
Or what other B vitamins you're taking at the same time. Yeah. B vitamins usually have the effect of giving you the like neon green kind of thing.
The Mountain Dew pee.
Yeah, exactly. So, when it comes to methylene blue, most people, what they'll feel is that energy, that subtle energy lift. And that can be manifest in a lot of different ways. It can be manifest in performance related tasks. And so I've worked with athletes that use methylene blue now to help with their endurance, because you have this additional ability to make energy for a longer period of time. Even if there's not oxygen around, you have methylene blue, which can act the same way as I mentioned before. So you get this additional energy bump, this energy sustained that you may not have without methylene blue around. So cognitively, you're going to feel that subtle increase in performance. Oftentimes what I'll hear from people is that they don't get that afternoon lull as much when they're taking methylene blue, because they still have this ability to continue to make energy and continue to have brain function, as opposed to not having that at 2 or 3 o'clock in the afternoon kind of thing. And also we'll have people talk about the various aspects of supporting their system in the context of chronic medical illness, right? In the sense that could be post-viral syndromes that are very common right now, significant improvements in fatigue, in cognitive function, in the post-viral aspects, or even the post-vaccine aspects of certain things that are being used right now. And also in mold illness, in patients that are using it for various infections, also in perimenopausal women, actually significant improvements in just cognitive function, brain function, in those capacities. So those are some of the categories of people.
Have you anecdotally or clinically seen anything where people apply it topically for skin cancers or anything like that, since it is anti-cancer or anti-carcinogenic?
Yeah, so I have heard there are some reports of methylene blue being, as an antioxidant, potentially preventing or mitigating skin damage. You may have to become a Smurf, though, if you like to put methylene blue over your skin. And so there's some reports of that in the research and the literature, but I haven't heard specifically about skin cancers directly and the application of methylene blue on them.
Okay. How about thyroid? Have you seen people improve thyroid function?
So I think with thyroid, it's super interesting. And a lot of and you're very knowledgeable about this, I know, Jodelle, more than me, but if you can work on the inflammatory cascades and energy production, like then in combination, that could be very, very helpful. So if somebody came to me and into my practice and said they want to use methylene blue for their thyroid function, the first 3 steps or 4 steps would be work on inflammation, work on optimizing cellular physiology. But along with that, I think methylene blue could be very supportive and could also move the needle and accelerate that movement of the needle, I think, as well.
Yeah, I felt like it did in my case anyway, because the mold toxicity had blown my thyroid out. So amongst other things, like you said, I think it was very beneficial. And I saw immediate, like within a first maybe week to 2 weeks, maybe like even a little weight loss from it. So I don't know if that's the
Metabolism.
whole, yeah, the whole oxygenation speeding up metabolism in order to help me just lose the inflammation weight that I was holding from the illness because I had put on 10 pounds just from the inflammation.
Mm. Yeah, it's a beautiful synergistic approach, right? Because you're working on the mold, you're doing all the therapies that are directed at that,
Mm-hmm.
but you have to also consider how metabolically that's going to manifest. And if you're supporting yourself metabolically with optimizing detox pathways, energy production, especially, you're going to see a accelerated result as a result of that.
Mm-hmm. Yeah. And now for the listeners, fast forward 5 years later, I'm still using methylene blue because I just love all the effects. And I will say during, we've all been through this pandemic of some sort of virus that's going around. We don't have to say the name, but I think that it was preventative against that. I never had any issues with it. So I continue to take it. I know other people that took it that had no issues with it. So I don't know. That's just my take on it. I wonder if, since it is antiviral, if it's got a preventative and, as you said, post-therapy aspect to it too, of both the virus and the vaccine.
I've seen a lot of that. That's for sure. As far as preventative, there were some interesting studies prior to the pandemic that if you combined methylene blue with certain spectrums of light, that it killed coronaviruses. Wow. So certainly interesting, especially if you like the sun and you like your methylene blue. And who knows? We will never know, as you know, Jodelle, because methylene blue is not a drug that you can patent, right? It's something that's available to anybody, anytime. And so that's not a pharmaceutical playbook at all. So, but I mean, what I've noticed with these kinds of people over the last several years now, but several months, a year and a half, I would say at the most, for the most part, is that it turns people's brains back on. It's like, and they suddenly have energy again, and they can dose in a specific way that helps them. And also, like on the detox side of things, like you can see different changes as you're using different types of dosing, is what I found over the years as well. And so I'll often start people at like a 4 milligram dose, which is a quarter of our troches. And then I'll have them work up to higher dosing depending on what their needs are as well.
Mm-hmm. Yeah. And I have to jump back to sunlight because that's my other big major player. I want all my clients to be out in the sun. And so, yeah, the intake with methylene blue and sunlight, what have you seen or how does it enhance it?
So we don't know exactly, but we think it's the blue color itself and the spectrum of light from sunlight. I mean, obviously sunlight has all the spectrums of light, but blue light is one of the major spectrums that we see in light. We think somehow it interacts with the blue pigment of methylene blue inside your mitochondria, and this revs up the whole process of making energy and everything that we just described earlier. And somehow we think probably on cytochrome oxidase is where things are happening, and there might be something going on with copper interactions. We're not sure, but it's all probably happening in the mitochondrial level. And then the other thing that's happening, obviously, in sunlight is that you're improving flow, right? You're improving blood flow, and then you're vasodilating. And so as a result of that, you're getting more blood flow to areas. And if there's more methylene blue around, or if there's methylene blue around at the same time, to allow you to produce energy more effectively and efficiently, I think that's also probably what's happening. But this is all conjecture. But sounds interesting. And I mean, obviously, when I talk to people, and I've had my own experiences, I've been interested to hear yours about how you feel when you combine methylene blue with sunlight. But usually, it's a very augmenting experience where you feel much more profound if you had just done one or the other on their own.
Yeah, I mean, my routine is to take my methylene blue first thing in the morning, and then I go out and I like to watch the sunrise. So I guess I'm just used to that. So that's just part of my MO. I don't know if I notice anything different, but I know that when I first took the methylene blue, that's when I noticed that my body just really resonated with it. And even now, if I feel any sort of like issue happening in my body, I just pound it back and then it works well. I probably still have a stain on the back of my tongue right now because I use some drops, but you were generous enough to send me some of your troches from Transcription. So I want to move there next and, talk to my listeners about why this buccal form through the troche right in the cheek can actually be a really good pathway into the body.
Yeah. So buccal troches have been around a long time in in mainstream medicine, kind of, but more like compounding pharmacies.
Yeah.
So compounding pharmacies around the country will compound various types of drugs into troche form. And a troche is this small square lozenge that dissolves between your cheek and your gums, usually on the upper right or upper left hand side of your mouth. And it dissolves over about 15 to 30 minutes. And the reason why we developed troches in my company, so there's 3 docs involved along with myself, so there's 4 of us, is that we wanted to make sure that we could make a pharmaceutical grade precision dose product that also affected the brain circulation faster and also was more bioavailable than most supplements that you will swallow. The thing about most supplements is that you swallow them, the bioavailability, which means how much of that supplement is available to you after you swallow it and gets digested by your stomach and your intestines and goes through your liver, usually on average is about 10 to 20% bioavailable. Mm-hmm. But when you're going through a buccal or a buccal troche, the bioavailability is upwards of 80% or higher. Mm-hmm. And so that is dramatic, especially for lots of different types of supplements. And so we wanted to make buccal troches that dissolved and that were very highly bioavailable. And then in the way of dissolving in your mouth, it actually drains into your circulation in your brain. And so as a result of that, you're getting these products, these supplements, our formulas into your brain circulation faster. So in people that need more of a brain focus, so for example, methylene blue, interestingly enough, is actually very bioavailable even through the liver. So you can swallow methylene blue and get just about all the benefits. But the benefit of letting it dissolve in your mouth is that it goes directly into your brain circulation. And so you'll feel more of a cognitive uplift as a result of using methylene blue and if it dissolves in your mouth. And so the other products that we've developed are not like methylene blue, are not as bioavailable. So not only do you get the brain improvements for having it dissolve in your mouth, but you're also getting more of the bioavailability at the same time.
So does it pass into like this? Are you saying like the cerebrospinal fluid? Is that where it's going?
Not the CSF, but all the vasculature that is in your brain drains into a venous system, and that venous system gets the compounds in it very quickly because the buccal, or I always say buccal for whatever reason, the buccal, your cheek is highly vascular, and as a result of that vascularization, all the blood gets drained into your brain circulation. And so the CSF, no, but the vascular system, yes.
Okay. Well, and it's good to know that it's buccal because I've always called it buccal too. So it's
good. For some reason, I like to say buccal. It just reminds me of like the guys with the horns. But right. I mean, but it's buccal is how you could, and the buccal meaning that it dissolves between your cheek and your gums. There's different types of lozenges out there. There's ones that are like you can put underneath your tongue or in other locations, but the buccal ones are formulated specifically to be very much dissolving into your buccal membrane, into your cheek itself. And the other thing that's really important about our troches is that they're very easily titrated. So they come scored, as I was alluding to before, into fourths. So you can break it up and have a quarter at a time or a half or 3/4 or a full. And so when we made the products, we made them at higher dosing, knowing that most people would likely benefit from less dosing and that they could titrate over time. Like, for example, the average dosing for most of our troches is a half of a troche. So we have one that's called Just Blue, which is pure methylene blue troche, 16 milligrams. But most people's dose is about a half of a troche. For me, my dose is a quarter. I'll take a quarter most times during the week, and that's all I need for the most part to feel that energy bump. But for some people, it's a half. Some people, it's a full troche. And if you're having other sort of acute kinds of things needed, you can go a higher dose. Or if you're traveling, for example. So when I'm ever going on an airplane and we have jet lag protocols that we've developed with our products that you can titrate your troche dosing to being at low oxygen when you're flying, for example.
Oh, wow. Yeah. Very cool. Now let's talk about, so one of the troches you guys carry is one called Blue Cannatine. And yes. I actually recommended it to a client of mine who was trying to stop smoking because it actually has nicotine in it. So I thought maybe this would be a way for her mouth to be busy so she doesn't have to reach for the cigarette, but yet it'll still give her that effect that maybe she's looking for from the cigarette. But can nicotine truly be good for us even when you're not smoking it? Because, you know, you hear the stigma around nicotine. So maybe you want to dissolve that a little bit.
Yeah, nicotine gets a bad rap. And and that's understandably why. I mean, it's in cigarettes. Cigarettes are terrible things to be doing. Vaping products are terrible things to be doing. Vaping nicotine, because nicotine, when it hits you immediately, releases neurotransmitters like dopamine that stimulate your reward system.
Mm-hmm.
And so the addiction potential when you vape or smoke nicotine is actually quite high. Also, nicotine in cigarettes and in vaping products, the amount of nicotine is super high, talking about between 8 to 20 something milligrams of nicotine per cigarette or per vaping product.
Mm-hmm.
But what people don't know is that nicotine, when you don't vape it or smoke it or use it high dosing, is a fantastic nootropic. It has been well studied in patients with mild cognitive impairment, with Alzheimer's disease, that it improves memory, focus, learning, visual spatial recognition, verbal fluidity, all of those things together. At low doses, when it's administered in oral forms that's not hitting you immediately, the addiction potential is extremely low. And the addiction potential of your cigarettes and your vaping products actually gets even higher when you're adding all the additives that are involved in cigarette or vaping smoking products. And there's actually good studies to show it's that the additives in those products, which have been developed over many, many centuries now, are probably the reason why people get so addicted to cigarettes and vaping products. And it's not as much the nicotine as we initially thought. So long story short, blue Cannatine was developed with low dose nicotine, 1 milligram per troche, along with caffeine, CBD, and then of course, methylene blue. And the idea is that nicotine is doing all the things that I mentioned at low doses. Caffeine is a stimulant. We all know it's the most widely used nootropic in the world. CBD is important because it helps in a number of different ways. It decreases brain inflammation. It helps give you more bliss. It's an anti-inflammatory overall. And then, of course, methylene blue is supporting your system by getting you more energy production, some antioxidant support. And so it's the combination of all four that gives you this productivity, focus, blast for about 3 to 5 hours, but with a slow on ramp and a slow off ramp. So you don't feel like jittery or like you're too focused, like you can't get out of that mode. I mean, some of the people that we've worked with over the years have been on previous drugs for ADHD, and they feel like this is a great way to have that focus without having all the downsides of some of those other drugs. Now, I don't recommend anybody stop any of those drugs without medical supervision, but these are just those kinds of an idea just to kind of give a feel of what it can do.
And it sounds like since the nicotine is a 1 milligram, that probably the addiction to the nicotine wouldn't be so in this troche because
it's impossible. Yeah. I mean, we have it so that we don't recommend you use more than 4 troches per day.
Sure.
Because it's about 4 milligrams or a little bit more that where addiction potential could be there. But again, that's only really in vaping and smoking products. It's not really going to be seen in a low dose, slow release formulation like we've developed in a buccal troche. But yeah, nicotine gets a bad rap, but nicotine's fantastic if it's used appropriately and used in ways that enhance brain function as a nootropic.
Sounds like it also would be really good as a pre-workout. Like it sounds like it would give you that energy, the movement, the motivation, but yet keep you like not too jittery and crawling out of your skin like a high dose caffeine pre-workout would. Right,
exactly. So yeah, you have to be careful with high dose caffeine and even high dose nicotine before you work out, because it's going to cause vasoconstriction. It's going to constrict down blood vessels, and that's not going to be conducive to doing your pumping of iron kind of deal, right? You want to have your blood flow for those. But low dose nicotine can give you the motivation to get up and get the hell to the gym and do your workout. But also what's interesting about that particular product, blue Cannatine, is that it enhances your flow. So your flow state while you work out or while you're exercising, while you're in a meeting, while you're giving you're speaking at a gig, a podcast, or whatever it might be, like all of a sudden, I mean, I've had this experience, and certainly I've had multiple people tell me this over the years. Like, I don't know what just happened, but I was in the flow state for 3 hours, right? And so we like to call it like our limitless type of troche, in the sense that you can have this ability to drop into that state. But the caveat is that we're stimulating you. Like, we have 2 stimulants in there. We have methylene blue, which is supportive, CBD, which is supportive for the most part, especially at low dose. But if you're not good with stimulants, or if you're overclocking your system, you might see a downside to it over the long term. So you have to be careful with that too.
Okay, so now we move on to my favorite, which is the Trocalm. So
Ah,
when you sent me the Trocalm, I had like orange teeth for like a week because I was so excited the first time I used it. I'm a naturally really amped up person. I'm just like a little squirrel all the time. So to find something that was so simple to put in my mouth, and all of a sudden I just sat back and I was like, I feel really good. Like
mm,
I wasn't tired if I didn't want to be. Like I think if you take a whole one, you could almost get help with the sleep.
yes, it
It was
can.
just like this calming feeling of like my world is okay, you know? So talk to me about Trocom and the ingredients in it.
Sure. So all of our products have been developed with a precision dosed pharmaceutical grade framework. And when, as myself, as a clinician, and I'm sure you as well, Jodelle, with your clients, and most practitioners out there know that like 70% of what they see is anxiety and stress.
Yeah, for
So,
sure.
what we wanted to do with our company was develop a product that was, again, low dose with multiple different ingredients, synergistic with the ideas of not just looking at this as a troche for all ills, but as a way that you can optimize the work that you're already doing and then have something that you can use on demand. And so the ingredients that we used in this are four main ones. The first one is Kava. So we all know Kava now. I think at least more people know what Kava is. Kava is an indigenous plant from the South Pacific, and it is well known to be GABAergic. So it increases the amount of GABA in your brain. GABA is your neurotransmitter that helps decrease the firing of brain signals and just relaxes brain function, calms you down. Okay. So that's number one, Kava. And we use a very specific formula that has something called 30% cavalactones, which are the active ingredient in Kava itself. Then in addition, we use two cannabinoids, two non-psychoactive cannabinoids, one called CBD, which everybody knows now, and then CBG, cannabigerol, which is less well known, but has very interesting properties for temperature sensation and pain sensation, and also affects various other receptors, not just the CBD1 or CB1 and CB2 receptors as well, in a way that helps decrease inflammation and also decreases anxiety and stress. And CBD, we all know these days, is really great for as an anti-inflammatory, but it also produces the increased amount of something called anandamide in our brain, which is another neurotransmitter that's responsible for giving us bliss, feelings of bliss. I grew up thinking that endorphins were why you felt so good after exercise. Actually, a lot of that is anandamide. It's this neurochemical that's being released, and ananda means bliss in Sanskrit, I think, actually. So it's been around. And so this is the endocannabinoid system. Your body has this system that produces cannabinoids or endocannabinoids. And these are the ones that are internal in our body. That this whole system was found because of the work that was done on the cannabis plant. So that's why they're called endocannabinoids. But anandamide is the one that's made by our body that stimulates these receptors. So CBD is preventing the breakdown of anandamide, so you get more bliss. And so you have CBD, CBG, and then the fourth one is something called nicotinyl GABA. And this is a very highly permeable, blood-brain barrier permeable form of GABA attached to a vitamin B3 that allows your brain more GABA very quickly. And so the GABA, as a result of this, in combination with the other GABA that's being produced by the Kava, and then the CBD1 and CBD2 receptors being stimulated along with the CBD and CBG additional factors that they're also doing, a lot of other neurotransmitter balance kinds of things that are happening. All that together is increasing your brain's calming mechanisms. And so at very low doses, at a quarter of a troche, 1/4 of a troche, that's usually a performance enhancer, because if you're somebody that's always hyped up, like you were describing, Jodelle, and other people that are sort of highly, let's call them sympathetic, your frontal lobe actually shuts off when you're sympathetic and you can't think as well. Everybody knows that feeling of like, it's like deer in headlights kind of feeling.
Squirrel brain, yeah.
Yeah. And so that's because you're not getting a lot of blood flow to your frontal lobe because you're too sympathetically activated. So a quarter of a troche is great for just taking the edge off and performing better. And so I had a half of a troche before this conversation today for that particular reason. And then you'll find a lot of high performers just take a little bit, like a quarter, and see a significant benefit. But as you go up in dosing, you get more relaxed as you go. And 3/4 to a full troche will actually turn off those ruminating thoughts that you have before you go to bed and prevent you from sleeping. So it's not necessarily a sleep aid directly, but as a result of it being a way to calm all those thoughts before you go to bed, you're going to have a decreased sleep latency, which is what all of us want. We want to be able to hit our pillow and fall asleep quickly. Yeah. And this product can help you do that. And actually, we've done some internal testing that it seems to increase deep sleep as well. Not exactly sure why, but it probably has to do with some of its GABAergic tone and increasing that.
Yes. Okay. So I want to go back to the temperature piece about the CBG, because I found that really interesting. So are you saying that CBG can actually help increase your body temperature? Like if somebody has like low thyroid, could it help regulate their body temperature better?
So the studies that have looked at this have been in pain. And so I don't know about the thyroid, but what happens with pain is that people with pain that's severe can often have dysregulation in temperature regulation within the areas that they have pain. And there's some idea that CBG may be able to help regulate those temperature sensors in a way that helps people have less sensitivity to pain because they don't have the temperature dysregulation. So it's unclear. I'm not sure if there's been any research in thyroid specifically, but it would be interesting to get a better sense of that and do some experiments in that capacity. So the answer is I don't know.
Now, there's the issue with the orange teeth. So I get up in the morning after I've had my Trocom the night before, and I got to brush my teeth really, really good to get all the orange off. So what is that? What's going on there?
Yeah, the orange part of it is just the coloring that we have for the Trocom. It makes your tongue a little bit orange. And the reason for that is really because we're trying to create the lack of stigma around this kinds of thing, because oftentimes people, stress, anxiety, those kinds of things. We wanted to play the other game, which is like, yes, I'm using Trocom. Yes, I have anxiety. Yes, I'm stressed, but now I'm using this and now I feel better kind of thing. It was sort of like a stigma thing for us. We wanted to make, just like our tongues turn blue from methylene blue, we wanted there to be another way that people could be out there and show the community, like, look, I'm using these things. I'm not immune to stress. I'm not immune to anxiety. Like, join us and try this as a way to help you too, kind of deal. So, and it comes off pretty easily, the orange, especially compared to the blue. Yeah. The methylene blue is much harder to get off compared to the orange from Trocom. So, for us, it was an intentional way to create a community around the world of mental health and performance as well. And like, look, I'm taking Trocom before my athletic pursuits, before things that I'm usually stressed at, and look at me now. Like, I can do these things better, and so can you. You don't have to, hide behind, pharmaceuticals and other things that, that have a lot of other side effects. This is a natural product that can work really well. And then in clinical practice, I'm using it all the time in my patients that we're saving them from having to go on those particular types of medications. And if they've been on those meds before, we have an alternative, something to try before going back on those things. Now, some people absolutely need pharmaceutical drugs and need to stay on those things. And I don't recommend anybody stop any of their pharmaceuticals without the direction of their providers, because especially drugs that affect the GABA system, like your benzos and like your Ativans, your Xanax, your Valiums of the world, those are unsafe to stop abruptly because you could have a significant reaction, and you could die actually for stopping those abruptly. So please don't do that. It's always important to do a weaning off process and doing it with your provider.
Yeah. No, for sure. And the orange is natural, like you use.
Yes, it's orange. Yes.
So it's not like an orange dye. Yeah.
No, exactly. Thank you for mentioning that.
Are there any benefits to annatto?
So annatto has a lot of vitamin E in it. At the dosing that we're using, it's probably not therapeutic in that capacity, but certainly not in any way detrimental.
Okay, wonderful. All right, so we've spent a lot of time on this, but it was really important that I share with my listeners about how cool these products are. And I'll have a promo code and a link that you've been generous enough to share with my listeners.
Of course,
so I'm excited to give them that. That'll be in the show notes. But in these last maybe like 10 minutes, let's shift gears and tell me let's move to hyperbaric oxygen. Let's talk about that. Let's talk about what is it, just like we did with methylene blue, and kind of the history behind it.
Yeah, I mean, my clinical practice as a provider is based on the field of hyperbaric therapy. And then I use all these tools, technologies, these supplements, these other biohacking whatevers ancient practices, everything all together in my practice when I talk to people virtually all over the world and clinics that I work with. And the key with hyperbaric therapy is that we're driving more oxygen into the system. And we're doing that by combining increased amount of oxygen that you breathe and increased amount of atmospheric pressure. Typically, there's 21% oxygen in the air that you're breathing right now at sea level, and we can increase that up to 100%. But that doesn't matter if you only have a certain amount of oxygen carrying capacity, meaning that red blood cells are how you carry oxygen. You only have a finite number of those sites. We were talking about that earlier, to carry oxygen throughout your body. If you put the pulse ox on, you have 96%, 100% of those sites carrying oxygen already. So what can you do? You can actually pressurize the body, simulate the pressure that you would feel under a certain amount of seawater. And then that pressure changes your physiology in a way that liquid oxygen can get diffused into the plasma or the liquid of your bloodstream. And so as a result of all that oxygen coming in, you have this effect immediately on the system. And then over the long term, that oxygen actually changes how your genes are being expressed from an epigenetic perspective. And so you have changes in physiology over the long term. Immediately, what you have is you have increased oxygen delivery. So if you've had an acute heart attack, stroke, trauma, surgery, acute fill in the blank where you have less oxygen getting to tissue, you can get more oxygen to tissue inside the hyperbaric chamber. You can prevent tissue from dying. So preventing people from having severe outcomes for things like heart attacks and strokes and traumatic brain injuries and spinal cord injuries and all those things. These are all well documented in the literature. You're also, as a result of getting all that oxygen in, you're also being able to kill bugs, for example. So bugs that do not like high oxygen environments. We're also decreasing inflammation immediately. We're decreasing pain immediately. We're getting more blood flow into tissue and more lymphatic flow out of tissue immediately by creating what we think is probably easy water, more exclusion zone water around blood vessels related to the pressure and to the oxygen itself. So that's all happening immediately. And then over the long term, you're changing epigenetics. And what that means is that you're getting this shift in expression where you're looking for growth and healing. That's new blood vessels, that's inflammatory pathways that are getting downregulated, that's stem cells that are getting released, that's changes in the amount of senescent cells or these zombie cells that can build up as we get older. And there's some evidence that telomeres can be potentially increased in size as well. And that's your 5-minute explanation of hyperbaric therapy.
Okay. So how does it work? So it's like a bed that you lay in?
Oh, so it's a chamber. So you go into a chamber and the chamber is pressurized. It simulates the pressure that you'd feel like under a certain amount of seawater. So like one of the more common pressures that we use is 33 feet of seawater, which is the equivalent of what we would call 2 atmospheres.
Wow.
And at 2 atmospheres, you get a lot more pressure. Anybody that's picked up a bucket of water knows that water is extremely heavy. Mm-hmm. And it's that heaviness that we can simulate in the chamber. And it's that heaviness that changes how oxygen is delivered to your plasma by driving it in.
Mm-hmm. And so
sorry about the dog.
That's okay. We're dog friendly here. So it's all right. Yeah. So in the chamber though, if it's like 2 atmospheres, does that mean you're equalizing? Like, do you have to equalize?
Yeah, exactly. So like when you're going down from 0 feet of seawater to 33 feet of seawater, you have to continue to equalize your ears as you're going down. Okay. But when you get down to your pressure, then you don't need to equalize your ears anymore. You're good to go. And you just stay there for your treatment length, 60, 90, 120 minutes, depending on the protocol. And you come back up at the end, you feel that same pressurization in your ears.
Okay. So there's acute benefits. Like you said, there's stuff that happens immediately, but then there's chronic long-term. Like what is a good standard amount of time that you're going to do this over the long term?
It really depends on your goals. And if you have acute immediate goals, then usually the amount of hyperbaric therapy you need to do is not that much. Maybe a couple of treatments, maybe every once in a while for muscle recovery, for jet lag, for an acute injury. You're in there 2, 3, 5, 10 times maybe. And then, but over longer term goals, chronic complex medical illness, optimal performance, longevity, these are when you want to shift those epigenetics like I was talking about. And that usually is more regular hyperbaric therapy, especially initially. So we're talking about doing therapy maybe once a day for 5 days a week, 5 days on, 2 days off for 20, 40, 60 hyperbaric sessions. And doing that initially shifts your epigenetics, changes everything that I was describing. Then you can do things more in a maintenance fashion over the long term to help maintain those. I mean, over the years, I've created lots of different types of protocols for people that either have chambers in their homes or go to facilities, or if they have conditions. It just depends.
And I'm really fascinated about the blood building aspect of it because I'm really hesitant to ever do blood transfusions or anything like that. I'm more in lines with there are ways to build blood naturally. It takes longer, yeah, but it can be a lot less risk involved.
So what we're doing in a hyperbaric environment is we're increasing the amount of oxygen in circulation. And so you're going to have more energy production capacity, like we've been discussing. It doesn't change the number of red blood cells that you have in circulation, though.
Okay.
So it doesn't directly blood build.
Okay.
But it can, if there's a lot of inflammation that's preventing you from making blood cells,
okay,
and you decrease inflammation in the chamber, you will get a bump in your red blood cell number. So it's not direct, because what stimulates more red blood cells to be made is the lack of oxygen, not more oxygen. No, not more oxygen. Okay. However, the caveat to that, and this is something that I've learned over the last at least a couple of years, because I would tell people, no, your blood counts aren't going to go up in the chamber. And they would come back to me like, look, doc, my blood counts went up in the chamber. And I'd be like, huh, what's happening? And then I realized what was likely happening is that because these are people that were having a very difficult time utilizing their stores of iron to make red blood cells. And so as soon as there's a particular marker called ferritin, for example, right, which I'm sure you're familiar with. It's an inflammatory marker, but it's also a sign of how much oxygen that you're storing that you're not using, right? And so if we can decrease their ferritin levels, then all of a sudden they're able to make energy more effectively because they're making more red blood cells with more iron in them, and so it's like a circuitous kind of way, but that's what was likely happening. So if you're anemic because of inflammation, and we decrease inflammation in the chamber, we're going to see those blood counts go up.
Awesome. And then what about like eye issues? Like when the mold hit me, my thyroid and my eyes were really affected. So does it help with eye issues and regeneration, or even like myopia or something?
So if I like to bring it kind of down to the basic physiology of what's happening in a hyperbaric chamber. So the first thing we're doing is reversing hypoxia, or low oxygen states. So immediately and over the long term by creating new blood vessels. The second thing we're doing is profoundly decreasing inflammation. Yeah. So when you do that, you're letting the body do what it needs to do to heal. And that doesn't matter if it's your eyes, your thyroid, your genitals, your toe. You decrease inflammation, the body's going to be able to do what it does best, which is heal itself. That's all it does. And so that's the second thing. The third thing we're doing is releasing stem cells. So stem cells to get to areas where there's inflammation, where there's infection, where there needs to be healing done. And then the fourth thing is just increasing flow. So those are the major things. And so when I think about, when somebody comes in with sort of a systemic inflammatory condition, if we're decreasing inflammation, it's going to help no matter what those symptoms might be. So if it's your eyes, for example, decreasing optic inflammation is going to make you feel better and help your eyes function better. Brain inflammation, same deal. Just it's a global phenomenon, let's call it. What we're doing in the chamber, and then where the inflammation is most profound is where we see the most changes inside of a hyperbaric environment.
I love that both of these compounds, whether it's the hyperbaric or the methylene blue, they're both kind of doing the same thing. So,
I use them together.
Yeah.
Yes. And so I'm using in a lot of brain related injury, whether it be brain fog, neuroinflammation from post-viral stuff, or traumatic brain injury, stroke, dementia, Alzheimer's, Parkinson's related. I'm seeing a lot of benefit, mild cognitive impairment, by using methylene blue at the same time as using hyperbaric oxygen therapy. And the combination is much more powerful. I mean, this is me anecdotally so far, but I've seen amazing things with methylene blue on its own. And your experience is a great example of that. But also combining these things together has been fantastic. And then you add on things like neurofeedback or meditation or other ways of trying to recalibrate their brain function. And then it's just synergistic modality upon synergistic modality.
Yeah. So then, like, the $1 million question is, for somebody who doesn't have access to hyperbaric oxygen, like myself, living in the Midwest, can we replicate this a little bit on our own? Like, is there breathing exercises, or can we somehow increase our oxygen naturally?
Yeah, it's a great question. I mean, I think certainly when you're vasodilating your blood vessels, you will be getting more oxygen to tissue that may not be getting as much. So cold and heat are also great for these. So cold thermogenesis, what's happening with cold, you're constricting down and then you're vasodilating after you get out of the cold because your body responds that way. You're going to get more blood flow to your periphery, to other tissues you may not be getting them to initially. So you will get more oxygen infused to areas that you wouldn't get otherwise. Heat exposure is the same thing because you're sweating out all the heat and all toxins, et cetera. So for high heat, saunas are really good for this, for example, because you're getting a lot more vasodilation to your skin. And of course, it's a good cardiac workout too. In addition, when it comes to breathing practices, there's one that is really interesting to me, which is called apneic breathing practices. This is when you hold your breath for periods of time. This is relatively new research for me, but it's been around for a while, where if you hold your breath for a period of time, you have what's called a splenic contraction. Your spleen contracts a little bit and releases more red blood cells into circulation. So you can increase your oxygen carrying capacity by doing apneic breath holds, but I don't recommend you do that without instruction.
Sure.
The person that I rely on for most of this work, his name is Brian McKenzie, and Brian has been doing breath work and all this work for a long time. You guys can look him up. He has a lot of training, and if you've heard of him before, but
he's cool.
He's awesome. Yeah.
I need to get him on the show too.
Yeah. He doesn't go on podcasts anymore. I've tried, but he does a lot of really interesting work with breath work and understanding oxygen carrying capacity in this context with splenic contraction is really interesting to me. You'll hear people like Wim Hof and others say that they're increasing the amount of oxygen in the body. That's not exactly true, but what they are doing is increasing oxygen utilization. Okay. So there's ways to increase oxygen utilization. If you do hyperventilatory kinds of breath work and then you do exercise, you're going to dump more oxygen to the tissue that you're exercising. So that's another way you can do it. And then there's also exercise with oxygen therapy, which is the bikes that you're like on a bike or a treadmill and you're breathing 100% oxygen or something like that. And maybe even contrasting it with low oxygen at times too. There's a company that does that, like adaptive conditioning. That would likely also increase the amount of oxygen in circulation too. So those are some ways. And then of course there's methylene blue as a way to support the system, help with energy production, and easy to do. It's just something you take, instead of having a contraption you have to buy.
How do you feel about building some CO2 to help create the need for oxygen? So doing some breath hold exercises where you hold your exhale out and do some of those kind of exercises where that stimulates the need for oxygen.
Well, we know that when you're doing that, when you're breath holding, you are vasodilating as well. Okay. So because we know that carbonic acid, which is sometimes used in various types of modalities, is stimulating because what'll happen when you're under low oxygen conditions, your brain will start dilating and because they're trying to get more blood flow to the area to get as much oxygen and take away as much carbon dioxide as possible. So you have to be careful with breath holding. You have to be careful with CO2 retention, but as long as you're doing it in a safe place, like not at altitude, not when you're like jumping out of a plane or in water, in a safe location, then it's probably okay.
Cool. Well, in the meantime, I want to come see you and try this hyperbaric, but I'll just keep using my methylene blue, and the troches are wonderful. So I'm excited about continuing those. So This has been really fun. And I hope that people can really have some takeaways here about the importance of oxygenating our mitochondria. And so if people want to work with you or they want to come see you, how can they do that? So the best place to find me is probably my website, or the name is my name. It's drscottsherr.com, DrScottsherr.com. That will redirect to my other site that's mostly focused on hyperbaric therapy, integrative hyperbaric oxygen therapy. And I do consults and I work with people all over the world, helping them understand how best to use hyperbaric therapy in the context of this greater idea and the greater framework of hyperbaric therapy is just one tool in a larger toolbox, and it may not be right for you right now. There are options potentially to rent hyperbaric chambers or even buy hyperbaric chambers for your home. And I do have some resources there that you can find through my website or through contacting me. And that's another way to experience hyperbaric therapy if you're not able to afford a chamber itself, or you're not in a location where the chambers may be available to you, like Southwest Missouri or some other place. So you can find all that work there. And then on the company is called Proscriptions,
prescriptions with a TRO in front of them,
right,
because we're precision dose, pharmaceutical grade, and physician formulated with everything that we do. And that's at troscriptions.com.
yeah.
And also on Instagram at Troscriptions. I'm also on Instagram at Dr. Scott Sherr. And so I know you have some promo codes for people, Jodelle, as well. And so, yeah, we'd love to hear experiences from everybody across the spectrum of health. In my clinical practice, I work with all different types, and our products are really fantastic and titratable, which is great. So you can start off at a lower dose and kind of find what dose is right for you.
Yeah, highly recommend. I've already been enlisting them into my clients' protocols, so I think
Awesome.
they're wonderful. So I'll have all those websites you mentioned in the show notes. Last question for you, Dr. Sherr, is I like to ask people one of my favorite questions, and it's from a quote by Audrey Hepburn that is, I believe that every day should have at least one exquisite moment. So, Dr. Sherr, what is your exquisite moment today?
Today. So today, my exquisite moment was my backyard just got redone after we had some fires in our area about 6 months ago now. And a lot of the area got devastated. Unfortunately, our house survived, but a lot of damage to the backyard. And so the whole backyard was redone. They finished yesterday, and I got to go out on our new grass with just me and the grass and sit out there for 10 minutes this morning during my meditation. And it just was like a Zen moment. It was beautiful. And so that would be my moment today so far.
I love that. That's awesome. Well, congratulations on your lawn. That sounds
Thank you. Yeah, it's just nice to be able to get out there. Second best would probably be like getting woken up by my children and, the usual fun stuff that happens.
Of course,
with that. So,
yes.
Yeah.
Well, thank you so much. This has been awesome. And I hope to have you back. We've got more to talk about, I'm sure, because you're a wealth of information. So thank you.
I'm always happy to come back, Jodelle. Thank you for your time. This has been a lot of fun.
Awesome. All right. Bye for now.
Light bulb moment. I have an idea for you. How about getting an anti-blue light bulb? That's right. You could put these in your house at night and they would not allow any blue light after the sun goes down. I have these in my lamps and I really love them because it's like this amber glow at night that's not offensive to my melatonin at all. Now you may know that I'm kind of a blue light blocking glass junkie. In fact, when I'm not wearing this pair, I'm wearing this pair, yes. And when I'm not wearing this pair, I might put on this pair. And in case I don't want to wear my contacts, I actually have my prescription pair. Check that out. You can kind of see that it's different than the other lenses. This one's actually going to have my big, thick Coke bottle glass prescription in there, so that I can wear these and not have to have my contacts in at night. So yeah, I'm kind of a blue light blocking junkie, but what I'll say is that my sleep has never been better, and it's as simple as putting on a pair of glasses or using a light bulb that blocks out the blue light at night, or perhaps you want a little night light for your kids, because here's the thing. Blue light, night lights actually cause myopia in children. That's right, they can become nearsighted if they're exposed to blue light after dark. So getting one of these anti-blue light night lights for the kids or for yourself, stick it in the bathroom, stick it in the kitchen for those late night munchies, which you shouldn't have if you're blocking blue light. That's right, blue light actually stimulates your cravings after dark. So by wearing these glasses, not only will you sleep better, but you may not get those late night munchies that are so prevalent. So Fit for 10, that'll save you 10% off either your favorite pair of glasses or the really cool light bulbs and night lights. Hey guys, are you in the Midwest? Are you in the East Coast? Are you in Brazil? Are you in Asia? It doesn't matter where you are. I would love to work with you as your nutritionist. And so just to let you know, I offer nutrition consulting worldwide. You can work with me anywhere. I have clients all over the world, and I love to spend time over the internet with each one of them, figuring out their specific needs. So your specific need, what deficiencies are you having? What symptoms are you dealing with daily that we can address for you? So that's what I, as a nutrition detective, like to get to the bottom of. I ask you a ton of questions. We meet over Zoom or over FaceTime, whatever is convenient for you, and we discuss all of your specific needs. If you would like to work with me, just shoot me an email, getfitwithjodelle@gmail.com. That's getfit, GETFITWITHJODELLE @gmail.com. and let's set up a 15-minute free call for you just to see if I'm a good fit for you as a nutrition therapy practitioner. Again, email me getfitwithjodelle@gmail.com and let's get you set up feeling better, lose that unwanted weight that you have going on, lose those symptoms that you have hanging around, and optimize your health as best we can. Well, if you've listened to me at all, you'll know that I preach protein, and protein is the building blocks of every healthy cell in our body. And you need protein throughout the day to sustain really good, healthy cell turnover. And I get asked a lot, what about if I don't have time for protein? I can't really get in a meat source. It's okay. I love a good whey protein. And my favorite recently has been this grass-fed whey from Iconic Protein. I love their ingredients. I love that they use a monk fruit. It's simple ingredients. There's literally 4 ingredients in this protein powder, and it's not going to cost you an arm and a leg. There's a lot of grass-fed protein powders out there that are like boutique-y, and they're all about, $50, $60, $70. No, this guy's going to run you less than $30. And with my discount code, you're going to get 15% off. So check out Iconic Protein. They also have, for those of you really on the go and you don't have time for anything, even blending up a protein drink, you can get their Immunity Coffee. Now, I love my coffee. And this Iconic drink is made with MCT oil and all natural ingredients, and it actually has a few vitamins and minerals that help with immunity. So this is something I'm going to grab. I'm going to add it to my coffee. Maybe I'm going to drink it on its own. It's a really nice way to grab and go. So for those of you that say, I don't have time for protein, now you do. Check out Iconic Protein and their Immunity Coffee, as well as their different flavors of protein powder. And use my code JODELLE, JODELLE, to save 15% off your Iconic Protein purchase.